Vaccination plays a crucial role in maintaining the health and well-being of pigeons. In this article, we will discuss the reasons why vaccination is important for pigeons and how it helps prevent the spread of diseases. Vaccination not only protects individual pigeons but also contributes to the overall health and population management of these birds. Disease prevention. Pigeons are susceptible to various viral, bacterial, and parasitic diseases. Vaccines help prevent the spread of these diseases and protect the health of pigeons. For example, viral diseases like Newcastle disease and Paramyxovirus can cause severe health problems in pigeons. Vaccination provides immunity against these diseases and reduces the risk of pigeons getting sick. Population health. Vaccination plays a crucial role in maintaining the overall health of pigeon populations. Diseases can spread rapidly within a flock, leading to outbreaks. Vaccination helps control and prevent the spread of these outbreaks, thereby safeguarding the health of the entire pigeon population. Enhanced performance in racing pigeons. Vaccination can improve the performance of racing pigeons. During races, pigeons may experience stress, which can weaken their immune systems. Vaccination ensures that pigeons have a stronger immune response, helping them perform better in races and reducing the risk of illness. Preservation of genetic heritage. Vaccination is vital for the preservation of valuable or rare pigeon breeds. Protecting rare breeds from diseases contributes to their conservation and helps maintain genetic diversity within pigeon populations. Conclusion. Vaccination is a crucial tool for protecting the health of pigeons, preventing the spread of diseases, and maintaining the genetic heritage of valuable pigeon breeds. It is important to implement regular vaccination programs under the guidance of a veterinarian and administer appropriate vaccines based on the specific needs of the pigeons. Pigeon vaccination records are typically issued by veterinarians. A vaccination record, also known as a vaccination card or certificate, is a document used to record a pigeon's vaccination history. Here are some reasons why pigeon vaccination records are issued by veterinarians and why they are important. Veterinarians. Veterinarians are professionals specialized in pigeon health and care. Issuing vaccination records and maintaining vaccination records are among the responsibilities of veterinarians. Veterinarians determine the appropriate vaccines for pigeons based on their specific needs and establish a vaccination schedule. Health monitoring. A vaccination record is important for monitoring and tracking the health status of pigeons. When pigeons receive regular vaccinations, the vaccination record keeps a record of these vaccinations. This demonstrates that the pigeon's vaccinations are up to date and that it is in good health. Additionally, the vaccination record can be used to determine which vaccines the pigeon has received in the past and which vaccines are needed. Validity and tracking. The vaccination record provides the pigeon's owner and the veterinarian with information about the type, brand, and date of the vaccination. This information is important for determining the validity of the vaccination and when it needs to be repeated. The vaccination record facilitates the tracking of vaccinations and ensures that the pigeon is regularly vaccinated. Sales and exhibitions. The vaccination record is important for documenting the vaccination history of pigeons. Particularly when pigeons are being sold or exhibited for activities such as racing or showing, potential buyers or organizers may review the vaccination record. The vaccination record serves as evidence to verify the pigeon's health and vaccination history. Pigeon vaccination records are important documents for monitoring the health status of pigeons, organizing vaccinations, and providing proof of vaccination validity to their owners. Therefore, pigeon owners should collaborate with veterinarians and keep their pigeons' vaccination records up to date. The vaccination program for pigeons is typically determined by veterinarians and can vary depending on the pigeon's age, geographical location, and exposure to risks. Here are some commonly used pigeon vaccines and their recommended timings. Paramyxovirus, PMV, vaccine. Paramyxovirus is an infection caused by Paramyxovirus that can lead to a severe viral disease in pigeons called Paramyxovirus. Vaccination against this disease should generally be done when the pigeons are 4 to 6 weeks old. A booster dose can be given 4 to 6 weeks after the primary vaccination. Subsequent annual booster doses may be required. Salmonella vaccine. Salmonella is a common bacterial infection in pigeons. The vaccine can be administered when the pigeons are typically 6 weeks old, followed by a booster dose 4 to 6 weeks later. Annual booster doses may also be necessary. Cholera, Pasteurellosis, vaccine. Cholera is an infection caused by the bacterium Pasteurella multicida in pigeons. Vaccination is usually done when the pigeons are 6 weeks old, followed by a booster dose 4 to 6 weeks later. Annual booster doses may also be required. Adenovirus vaccine. Adenovirus is a virus that causes respiratory tract infections in pigeons. Vaccination is generally done when the pigeons are 4 to 6 weeks old, followed by a booster dose 4 to 6 weeks later. Annual booster doses may also be necessary. These are some commonly used pigeon vaccines. However, factors such as the climate of your region, the risks your pigeons are exposed to, and the recommendations of your veterinarian can affect the vaccination program. Therefore, it is important to consult a veterinarian to determine the vaccination program for your pigeons. Your veterinarian can create a vaccination program based on your pigeon's specific needs and provide guidance. One-loft races typically do not accept pigeons without vaccination records. These races take various measures to maximize the health and performance of the pigeons. A vaccination record, also known as a vaccination card, is a record system that documents a pigeon's vaccination history and ensures health control. Allowing pigeons without vaccination records to participate in races can pose serious risks and increase the likelihood of transmitting diseases to other pigeons. Vaccination helps protect pigeons from infections and diseases. Allowing pigeons without vaccination records to participate in races would jeopardize the health of all pigeons in the competition. Here are some potential drawbacks of accepting pigeons without vaccination records. Risk of disease transmission. Allowing pigeons without vaccination records to participate in races can increase the risk of transmitting diseases to other pigeons. This can put the health of other participating pigeons at risk and lead to outbreaks. Participation of unhealthy pigeons. Pigeons without vaccination records are more likely to be unvaccinated or unhealthy. Allowing these pigeons to participate in races can affect their performance and hinder fair competition. Loss of reputation. Accepting pigeons without vaccination records can damage the reputation and credibility of the race organization. Other pigeon breeders may not trust an organization that allows pigeons without proper vaccination records to participate in races. One-loft races typically make vaccination mandatory to protect the health and performance of the pigeons. Not accepting pigeons without vaccination records is a precautionary measure taken to ensure the health of all participants and maintain the integrity of the race. This helps protect pigeons from diseases and ensures the reliability of the race. In conclusion, one-loft races generally do not accept pigeons without vaccination records. Allowing pigeons without vaccination records to participate in races increases the risk of disease transmission and hinders a healthy and fair competition. Vaccination is important for protecting the health of pigeons and achieving high performance in races.